Okay, everyone see this okay?
Yes.
And you see me in the top right-hand corner here?
Yes.
Okay, so we were talking about being gored by a cow before, and the one thing that I forgot to talk about was a nodosity that looks like this. Do you see that little lump over there? That's a rock hard little node underneath my skin, which is about the size of a little tiny hen's egg.
Is that what a nodoscopy is?
A nodosity means a bump, a lump.
Okay, thank you.
Or a contusion. And what I did on the last go round was I talked about everything else, but not this, because it had not happened to me. So let's go back and we start with what actually happened. This was day one when I got gored, and it hurt a lot. Then it got worse and worse looking, and the remedies that I was applying were ruta arnica, calendula, Hepar, lachesis, ruta arnica, and it rapidly, if there was an infection, it rapidly dissipated. The black and blue rapidly dissipated, as you can see. And in about 13 days, this started to appear. This highlighted yellow area started to get a little lump underneath it, and that lump is a contusion. And that lump started increasing and the rest of the wound started healing. And I would get burning under that lump, for which Staphylococcus aureus 200 really helped. Now let me explain what Staphylococcus aureus 200C is. It is for cuts that are very deep, cuts that go through your dermis, your epidermis, your muscle. And what are those? Can anyone describe what those cuts typically are?
I don't understand your question, what those cuts are.
Where do you get cuts where it cuts all the way through your skin, through your fat, through your muscle?
If someone,
Knife. Surgery.
Yes. Surgical cuts, knife cuts. That was the kind of pain I had, burning pain in a little line. I could feel it underneath that contusion, underneath this contusion over here. It's as if it was broken from the inside and it was sort of seeping. And Staphylococcus aureus 200 really helped because I reckon it was a cut and the body was trying to heal over that with a contusion. The other thing that really helps, someone had a question?
Yeah, I wanted to show you that one says anger.
Yes, it can be suppressed anger. Staphylococcus aureus also for suppressed anger. Things of the round sphincter muscles. If your heart feels constricted, if your rectum feels constricted, it's a great remedy if you're pooping too much or too little, your sphincter constrictions. It's a great remedy for cuts that have gone all the way up and down your tissues. And so Staphylococcus aureus 200 really helped, along with Rus, which is for fascia. So I was taking, by March 5th, I was realizing that the wound is healing and I needed to take something to treat the contusion. And immediately the burning pain went away. I have it with fermented cod liver oil, the sun, and so a lot of vitamin D. There's a little scab on the horn where the horn hit me, and the scab fell off. So there's a very tiny wound over there. But then this all vanished, all went away, and look what is popping up instead. What is popping up is this little nodosity. This little nodosity right here. And that is what I currently have. And that is something that happens after an accident, after a trauma, especially abdominal, where if you get kicked by a horse, like Richard was telling me, someone got kicked by a horse and she had a lump in her belly for 6 months until it vanished. So that's what the body does to harden tissue, to protect itself, to keep a hernia from happening. At first I thought it was a hernia, but you know what a hernia is? It can pop in or out. Your organs, your intestines, if you press it, it pops in and out. This is a rock hard thing. And so I am giving away the remedies, but can people guess without looking what the remedies for this are? I'm giving it away. Bellis perennis is a wonderful remedy for deep tissue injury, for trauma, and you have it. I believe you have it. Calcarea florica is another remedy that is wonderful for tissue that has hardened. Bones that have exostosis on them, meaning tumors on them. Tumors in your muscles and your connective tissue in particular. So this looks to be like a little tumor in my connective tissue. And so what I'm taking is Bellis perennis, high dose from time to time, and I'm taking a low dose of the cell salt calflor. And Staphylococcus aureus if I ever feel a little burn underneath this. But look how nicely it's all healed.
Would you say the last homeopathic that you mentioned is something that's not familiar to me?
Bellis perennis, Calcarea florica.
Calceric floric, okay, that's it.
Yeah, and cell salt, that's in the little square bottles.
Yeah.
And Staphylococcus aureus if you feel an injury, an actual cut underneath.
Good.
So you have to be somewhat intuitive. You have to sort of know what's going on. Arnica is not really going to work for this. Can you guess why?
Because it won't deal with the deeper
Exactly.
injury.
Exactly. It would have worked if I'd never used arnica and there was an injury, and then I continued to use arnica high. But I've already used arnica, and it's actually not done anything to the nodule here, the node. And so the remedies for that are the deep tissue remedies, Bellis perennis. Bellis is also accompanied by vertigo. I had slight vertigo. And so that's a wonderful remedy when you feel dizzy when you're walking, when you have nodosity, and then Calcarea florica. And so that is the end of this saga. And what I'll do is, as it reduces, I will do updates to it, and I'll post it to the Gored by a Cow playlist so that you have the remedies on record and in your head for if something like this happens to you.
When you use Calcerica florica?
Yeah, florica.
Yeah. So that was directly because of the nodule, or is that because of your other sense of its deepness, or what was that?
Nodule. Calcarea florica is for hardened connective tissue.
Okay. So that would apply, for instance, I cut my finger maybe now a month or two ago, and it's a little nodule where
Yes. Yes. And what the body is doing is protectively is piling on connective tissue over there. If it is scar tissue, you want to take thiocyanamine. Thiocyanamine will swiftly get rid of scar tissue. Calflorica will get rid of connective tissue lumps and nodosities. And Bellis perennis is very good for abdominal trauma in particular, deep trauma that is not touched by arnica.
Scar tissue again.
Thiocyanamine.
How do you spell
How
that?
do you spell it?
Thio, THIOSINAMUM. And it is very important to use in fact, I should add that. I'm going to add that because that's so important. Thio.
There, she's got it on there.
There. Now I have it here, and you will have it forever.
THIO.
Great.
Yeah. Thiocyanamine. And so what you have to know is you have to know what to use when. And folks, I will tell you one thing. These remedies should be with you before you need them. You should not have them ordered after you're injured, after you fall, after you hit a stone and cause trauma in your belly or your head or wherever.
Sushi, I have a question about whether they can expire because I went to buy some and it was on sale because they said it was expiring soon.
Excellent. Buy it all up. It never expires.
Okay, that's what I thought. I did buy it.
It will
Good
last
job.
150 years and
That's
work
what I
perfectly well.
thought. Okay.
Yes. There are remedies from the 1800s that people have used that work perfectly well.
Thank you.
Okay, so now we're gonna do a pop quiz. You get gored by a cow. First thing, what do you take? Anyone guess?
Arnica.
Yes. And what else?
Yes.
You guys, you are trembling. You're in shock. What do you take?
Aconitum.
Aconitum.
Yes, yes. Then you feel severe pain. What do you take?
You feel what? I couldn't-
Severe pain, severe
oh,
pain.
severe pain.
Guesses? Take wild guesses. They're all correct.
Arsenic? No.
Vigorous.
Arnica, arnica is right. You guys said arnica. Arnica is for pain after trauma, bruising after trauma, severe pain, unbearable pain. If you have nothing else, keep aconite and arnica in your purse.
What about Traumeel?
Traumeel too. Traumeel has aconitum in it, arnica in it.
Yeah.
Keep Traumeel.
Okay.
It's awesome. But you have to have the presence of mind to do it.
Yeah.
Ice is a wonderful thing. If you have a sudden injury, icing it will really help and keep you sort of stable. All right, now it turns seriously black and blue, and you feel there's a wound on the inside of your belly. What are you doing? What do you take? And somewhat yellow, green. What do you take?
Bellis?
You could take Bellis, absolutely. It's more like blackish. It's gone from black and blue to from blue, purple to blackish.
When do you take the I think you said something phosphorus or
No,
No.
not phos. But
He said,
what is black? What is black and gangrenous? It is.
Dead tissue.
It's dead tissue. If there's dead tissue, if the injury, if the trauma is so bad that you have internal bleeding, you feel it's turning septic, lachesis, guys, lachesis, arsenicum, and Hepar sulf. Hepar sulf, you're gonna see yellowness on your skin. Lachesis, you're gonna see black, blue-black. Arnica, more purple, red purple. And as the degree of color changes, you need to be able to change your remedy and have all those remedies in any potency, really, just as long as you take it. 3 globules or 1 or 2 globules on your tongue dry, or 3 globules in water, a little bit of water, and take a teaspoon every 2-3 hours.
It's maybe a hard question to answer, but will the color change in a certain progression, or is that depending on what the situation is?
Yes, it will change very fast as it heals. My wound would have lasted for 2-3 months had it not, because I know my body. I bleed and bruise very easily. In 13 days, it was completely cleared.
My question more specifically, does it go from black to blue to yellow, green, or?
Yes, it does. In the course of healing, it does. And so you have to make a judgment call. Is that yellow-green healing, or is that yellow-green meaning it is worse?
Is it infection, for instance?
It's an infection, yeah. And so you will know if it's swollen, because my belly, which is now down, had swelled up to 3 inches. So I knew there was bad trauma in the belly. And so I took Hepar, I took lachesis for a couple of days. All the colors subsided, and it rapidly started turning pink again. The skin colored again.
You said something the last time you started talking about the cow goring, and you talked about the extra layer of fat, and you kind of joked that you had been fed and that helps you to some degree.
Yes.
That seems to me like a good, I'm not sure if it's prophylactic, but a good thing to have an extra layer of fat there.
It is very good to have an extra layer of fat. It is very, very good because that fat literally shielded the trauma. It acts as insulation on very precious organs inside that have literally no protection otherwise. So some visceral fat is a wonderful thing, especially right under your dermis, right under your skin. You
Mm.
want to have a good layer of fat. If I had been very muscle bound and had very little fat, chances are the horn would have gone through.
Mm.
With the fat, it kind of just went in and got squishy. So it acted as insulation.
Yeah, one of my neighbors fell and broke the hip, but it was not as serious because there was a layer of fat there.
Yes, yes, on your hips, especially if you're older, it's a good idea not to have something to protect you. Shoulders, hips, you tend to break things more easily as you know. And if you have an accident in particular, that's a useful thing. So we went through all the remedies and calendula for wounds that you feel are not granulating, and calendula as an antiseptic in general. Echinacea is a wonderful remedy for if you feel you have sepsis meaning infection inside your body. I didn't think I had that, and for me, it was more external injuries, and so I stuck to the remedies that I had, and I got good results.
Would you take calendula for the infection or a supposed infection or not?
The couple of days after I took calendula, yes, because I thought it was a little injury and there's that point, so I took calendula, and that helped. I did take calendula.
Is calendula usually used for superficial? I know it's, people make lotions and tonics, whatever. Yeah.
Yes. So calendula is for superficial lacerations, injuries, where the wound is not granulating, meaning skin is not growing over it. Calendula will do it pronto. Do not use calendula for deep wounds, because what it'll do is it'll cover it up without healing it from the inside. For deep wounds like knife cuts, surgical cuts, or deep gores, use Staphysagria. Staphysagria will heal it from the inside out.
We had our Dr. Christopher years ago that we went to, and he would have his herbal remedies. And if you had to cut yourself with a knife and there was profusely bleeding, he packed it with cayenne.
Yes.
And it would stop the bleeding and it would help it to heal very quickly. Yeah.
Cayenne is so wonderful. Yes, cayenne, turmeric and ghee. But with arnica, it's almost magical. They have done side-by-side studies where arnica heals 70% faster. These contusions stay for a long time otherwise. And the after effects of those contusions are bad. And so the faster your body heals, the fewer the side effects. Now, my big side effect here is this lump of this egg in my belly, and I will monitor it and tell you when it slowly shrinks. It was bigger, and it's very hard. And so that makes me grateful because it's not a hernia. A hernia would not be like that. So body's protecting me from having a hole over there, which would mean that my internal organs would have popped out.
For external bleeding, I've heard that ice is a very good and appropriate solution for immediate stoppage.
Yes. And we were very lucky. The store lady made us sit down and gave me a bag of ice, and I sat there until I could get my wits. We could get our wits together.
Hmm.
And
So
just remember, if you don't have ice in your refrigerator, you have cold items in your refrigerator that can be used.
There you go.
Be creative. Yeah.
Yes. She gave us popsicle sticks from her freezer, the shop lady. That was so kind of her. To put popsicles in my belly. All right, so that's that. I'm gonna stop recording and stop sharing. And I will post it along with the other video.